What did they just pull out of that guy's mouth? What is this? What happens after a happy hour at the Blue Oyster? No, no, ladies and gentlemen. What they just pulled out of that guy's mouth and throat was a device called an iGel, which is essentially a small breathing tube that is used during general anesthesia to maintain the patient's airway, because of course they can't maintain it themselves and they can't breathe for themselves. It's a very handy device, and it's not only used in anesthesia, it's also used in emergency situations where the patient is suddenly unconscious and you need to get an emergency airway. You can just ram that thing down a patient's throat. It requires minimal training, so any reasonably qualified medical practitioner can insert an iGel. So this is what the device looks like. It's essentially a plastic tube with a sort of a rubber bit at the end, like a little foot plate. And it's got a breathing tube and it's got little ports at the side for suction. And it fits in the mouth something like this. So yeah, it's a cross section of a person, and it goes through the mouth, and the breathing tube connects to the windpipe here, and you get a little bit that sort of obtrudes into the esophagus or the food pipe. So this will help prevent any gastric contents, stomach contents from being vomited up and into the airway, which can cause catastrophic aspiration pneumonia. It's not as good as a proper breathing tube that goes directly into the windpipe, but it has its uses, and especially in the emergency setting, you're going to see a lot of that in the ER, or even paramedics using it. Get an emergency airway before they can put in a proper endotracheal tube. But yeah, you'd be surprised how big it is, and it fits quite snugly inside. So yeah, it's a really handy device. iGel. Oh, this guy's, you might have a little bit of sore throat afterwards, but anyway. Oh, I've seen this before. I've seen this making the rounds. Oh, this is the epitome of play stupid games, win stupid prizes. I think this is some Chinese guy who tried to do the fist in your mouth challenge. I don't know what it's called these days, but it got his girlfriend to try and stick her as much of her hand in his mouth, and it looks like his jaw just locked down. I'm not sure whether his jaw was dislocated, but maybe. And when that happens, all the muscles around your jaw go into spasm. And oh god, I don't know whether to laugh or cry. Most probably cry. I don't know if he is crying, but I would be too. It's quite painful. And it's quite dangerous as well. I mean, if that obstructs his airway, he could possibly be in really bad trouble. He could die. So yeah, the joint is called the temporomandibular joint, and so this is where the joint is, and if it pops out like this or slides forward, it becomes locked essentially. It's dislocated, and it's very sort of difficult to put it back. So I think they either give him some muscle relaxants or put him off to sleep. Don't do this at home, children. Youch. What are we watching here? Is this Woodcraft 101, or is it an operating theater? No, this is your typical orthopedic OR. And orthopedics is the specialty which deals with bones, joints, and things like that. And it is essentially carpentry. Very complex. I have to give it to my orthopedic colleagues. It is not very simple, but it is. You need a lot of brute force. So what they're doing is this. I think what you're seeing is the knee there, and they're trying to take out a tibial nail. I think that's what it is. So maybe this patient had a fracture sometime in the past, and he had what's called an intramedullary nail or a tibial nail, which actually goes through the bone. So it can help fix the fracture, and it looks something like this. And once the bone heals, sometimes that nail can stay inside, but sometimes it has to come out, and the only way to get it out is to sort of hammer it like what you're seeing there, because it becomes very fixed, and as the bone heals, it's going to sort of grow around it and sort of clasp that nail. And yeah, you just gotta hammer it out. Luckily, that patient is asleep, or probably has a spinal anesthetic and very deep sedation, so they're not gonna feel a thing. They will be sore afterwards. Oh yeah. Anyway, hats off to my orthopedic colleagues. Don't show them an EKG by any chance. Oh, here we go. people trying to fight anesthesia. Oh, you're gonna let her inject it yourself? Okay, yeah, it's fine as long as you're supervising. So you see that white stuff that she's injecting? So that's a very common anesthetic agent, and there she goes. She's off. Yeah, you can't fight it. So that's called propofol, that white stuff. And fun fact, it's the same medication that Michael Jackson used to try and go to sleep every night. The only mistake he made was that he trusted his boutique doctor, a celebrity doctor who's a cardiologist and not an anesthesiologist, to administer that every night. And even if you're doing it for sedation, there's so many things that you have to do to make sure it's safe. I'm pretty sure his doctor didn't do any of those things. You know, you had to monitor the patient's blood pressure, heartbeat, and most importantly, you had to monitor the breathing. Because the first thing that happens is when you give that stuff is you stop breathing if it's in enough quantity. So you have to support the airway and you have to support the breathing. So I think what happened to Michael Jackson was he went to sleep and he stopped breathing and he never woke up again. Yeah, so don't use that for sleep purposes. Here's another one, trying to fight anesthesia. Oh, doing the old alphabet song. I'm surprised though, they're not giving them, I hope they're pre-oxygenated, and they're not really monitoring her breathing. Whatever. Oh, nice, that's interesting. So you see those stickers they're putting on her forehead? Those actually read her brain waves, like a EEG, and it'll tell us exactly how asleep she is. It's called a bispectral index. So we can sort of tailor the amount of anesthetic you're giving, so we're not giving too much and we're not giving too little. And I like to joke with my patients. I like to tell them, don't worry, we can't read your thoughts with this. At least not yet. Yeah, she's out. Hey, thanks for watching, everybody. This was just a short little glimpse. Finding some interesting TikToks and clips of medical stuff. So if you like this sort of thing, please subscribe, leave a like, and tell me what you feel in the comments. If there's any weird and wonderful medical videos that you've seen and you'd like me to comment on. So stay safe, stay healthy. See you in the next one.